The Democratic Republic of Congo has now recorded more than 4,000 confirmed Ebola cases. The epidemic is now the second largest Ebola outbreak ever recorded, and it's been called the fastest spreading ever. The World Health Organization has recommended a full-scale human trial of the only approved Ebola vaccine to determine whether it can also protect against the deadly strain currently circulating in the DRC.
Somber-faced passengers await temperature checks after their boat was intercepted. Their journey took a turn when a man died after developing symptoms consistent with Ebola.
They took our temperatures and asked us a few questions about how we are. I'm fine, except for a little back pain.
All 200 passengers on board were screened by health workers upon arriving in Kinshasa. The checks come as the Democratic Republic of Congo stays on high alert following an Ebola outbreak declared in May. Government data shows the virus has spread to 5 provinces in eastern Congo. Although the outbreak remains far from the capital, officials are stepping up precautions. Everyone arriving by boat in Kinshasa is now being screened in an effort to keep the virus from spreading to the city, home to more than 17 million people. But on the front line, many responders feel abandoned. They're working 7 days a week without pay. Wiza Bondele is one of them. He goes door to door tracking Ebola, entering homes where someone has died and disinfecting everything left behind. In July, he joined other healthcare workers in a strike over unpaid wages and dangerous working conditions.
We work in risky situations. You may find yourself in a situation where a patient is vomiting blood and you have to clean it up. We face those kind of risks, and we deserve both our allowance and our salary.
However, the hardest part for him is the risk he's taking, not just for himself, but for his community.
I could become infected with this virus, and then I could infect my family and my neighbors.
WHO officials warn the outbreak is spreading faster than efforts to contain it. They're now urging Congo to test Ervebo, the only approved Ebola vaccine. The call comes as the death toll nears 2,000.
All right, for more on this, let's bring in Trish Newport. She's the emergency coordinator for Doctors Without Borders, currently based in Bunia in the eastern DRC. Hello, Trish. Welcome to the program. We've heard this is the worst Ebola outbreak in the DRC's history. How serious is the situation right now?
The situation is so serious. We see the number of cases increasing every day. About 60% of all of the deaths are community deaths. And what we know is that as long as people are dying in the community, the number of cases of Ebola is going to increase significantly. We see cases moving into new areas all of the time. And one thing that is extremely concerning is that there are areas where there's Ebola cases and there are not yet all of the pillars of outbreak response in that area. Some places there's not case management or surveillance or access to safe and dignified burials. And so as long as there's not a comprehensive Ebola response every single place where there's Ebola cases, we will see Ebola continuing to spread and the numbers continuing to increase and the number of deaths sadly increasing.
I mean, it really does sound serious what you're explaining. To make matters worse, we know there is currently no approved vaccine or specific treatment for the Bundibugio Ebola virus responsible for the current outbreak. Is that why it's so difficult to control also, or what are some of the other key factors?
I think one of the biggest key factors is this outbreak was identified very late. So usually when an Ebola outbreak is identified, you have a few cases. And at this point, you're able to set things up. It's all in one place. You can really engage with the community and you can train health workers as the number of cases increase, or hopefully you're able to stop it right away. When this outbreak started, there were more than 300 suspect cases. There were more than 55 deaths. It had spread to new areas. So to be able to scale up the response and train enough people from the very start was a challenge, and we've just never caught up to the outbreak since then. And Ituri is an area with massive humanitarian needs. It's an area with ongoing conflict, areas that are insecure, and so this only adds challenge to the context.
Right. Now, this takes me straight to Uganda, really, which borders the DRC. Uganda recently declared itself Ebola-free. Same variant, no treatment, no vaccine. So what did Uganda do better than the DRC?
In Uganda, it started very small. It was one case and then another case. And as I said, if you start very small, it's much, much easier to control. In Uganda, as in the Democratic Republic of the Congo, they know how to respond to Ebola. So in Uganda, they were able to put all of the pillars of outbreak response into place immediately, exactly where there were the Ebola cases. In the DRC, this hasn't been possible because it's spread across provinces, across health zones, and it really makes it much, much more difficult. All of the actors here on the ground are stretched to their limits. We see organizations reaching their capacity, but the number of Ebola cases continues to grow. It's growing much faster than the Ebola response is able to respond to.
Right. I mean, what needs to happen now to stop this outbreak from getting worse?
We need to have an increased amount of international resources that are coming into the country to help with the Ebola response. The Ministry of Health knows how to stop an Ebola outbreak, but there need to be more resources on the ground that are able to go to new areas where there are new cases, and we need to be focusing on prevention in areas where there are no cases right now. But at this moment, there's no capacity to do that.
Wow. Sounds really worse on the ground. Thanks for all that information, Trish Newport, Doctors Without Borders.